We welcome you all to Talk the Talk. My name is Janine Steen,
And I'm Tony Ann Antoniato.
the Masters of Myofunctional Therapy.
Together, we interview physicians, dentists, and other professionals to learn how their expertise can benefit you, your child, or your patient's speech and language skills and complement the services they are receiving.
Hello and welcome to Talk the Talk. Joining me today is Tamara Thomas, a registered dental hygienist specializing in myofunctional therapy with a passion for improving oral and systemic health. As the owner of Physique, Orofacial Myofunctional Therapy, a speaker for STAR course, an instructor for the accredited Oral Systemic Educator Course through the National Network of Healthcare Hygienists, a previous mentor with Airway Circle, and currently the 2026 president of the National Network of Healthcare Hygienists, Tamara is passionate about working collaboratively to improve oral and systemic health. Welcome, Tamara, and thank you for joining me today on Talk the Talk.
Thank you, Tony. It was nice to be here. I'm excited to spread awareness along with you and answer any questions.
Yeah, definitely. Thank you. If we could start with maybe a little bit about your story and how you kind of got into hygiene and how that took you down the path of myofunctional and orofacial myofunctional disorders. I'd love to hear a little bit about that.
Oh, yeah. So I started young as a dental assistant when I was 16.
Oh, wow.
I know. I was lucky. I was flipping pizzas before that. And one of the people there said you would be a really good dental assistant. And at the time, I didn't know anything about dental assisting. And she said, go find an office that'll train you because you can be trained on the job to do a dental assisting here in California. So I did. And then I really liked it. So then I knew I was going to be graduating high school, I wanted to go to college. So the next step would be dental hygiene. And after dental hygiene, all this time, no one looked at all that stuff. We
Yeah.
really taught about all this stuff, which was years ago. Then I had braces. So for me, I had braces 3 times and I
Wow.
kept getting relapse. And I had no idea why. I was very compliant with wearing my retainers. I did all the things I was supposed to do. And it was frustrating for myself. Then I had gone to a continuing education course because I love to learn things all the time. That's downfall. I'm always like, I want to do this. I want to listen to this or learn this. And it was actually put on by Nicole Goldfarb here in San Diego. She's a speech pathologist here. And I've told her like that changed my world because then I started looking at all these kids. I was like, all these kids who come to us in the dental field and parents are saying they're grinding their teeth. What can we do? And they're like, can we put a night guard? Because that's what traditional dental does.
Right.
And you can't do that in a child.
Right.
There's teeth that are coming, there's growth and all that. You don't want to arrest any of that. And so when I learned about that, I was like, wow. And I came back and told my dentist, these children that have these issues need to be seen by myofunctional therapists.
And what year was that about?
2015, 16.
Okay. So yeah. Still not a lot going on at that point.
Yeah, in the world of
Right.
all of this stuff.
Yeah.
Doesn't seem so long ago, but I think we've come a long way in my opinion.
Yeah.
So he asked me if I wanted to study it and I was like, well, I don't know, maybe. And so I realized I had all the issues, right? So I had the tongue thrust that was pushing against my teeth. I had grade 4 tongue range of motion ratio. And I was like, wow, nobody ever looked at that. So then I was like, a little skeptical, not to lie. I was like, really? Is this the answer? I was like, but I'm someone that will try everything before. I'll just try everything to see. I want to do it. Give me the answer. So I did my tongue tie release, my lip release, all of the things, and tested it to see, I didn't wear my retainers because I wanted to see if it was going to be different, if my teeth were going to start to separate. Mine was right in the front. And I was surprised that, being in the field, I can go back into having my ortho and all that stuff. It's a little bit easier than traditional people. I never recommend anybody stop wearing the retainers, but it's interesting.
Disclosure. Wow,
So
but that was a nice risk you were, able to do and see it for yourself.
yeah, yeah. So for me, then I was like, wow, there's something to this. And so then I
Hmm.
started doing it on the side to help do a few things, learn things, continue to take lots of education.
Hmm.
And from there, it just kind of blew up. I
Hmm.
never thought I'd be doing this,
Hmm.
honestly.
Yeah, that's great. I feel like so many, whether it be hygienists or SLPs that get into Myo, it really does usually have a personal story behind it, whether it's themselves or a family member. For me, it was kind of the opposite. Myo kind of just found me right after grad school. I just took a CF position, and it happened to be the practice I'm still at and now a business partner of that just specialized in myofunctional therapy. And I was like, Myo, what? What am I doing? I didn't learn about this in grad school. And then, fast forward several years later, I had my own children, and my second one, who's now 8, she had all the Myo stuff. So I was like, well, this is why I found Myo. She needed the expansion and she had the airway issues. And luckily, I was educated on all this and specializing on it. So able to identify it early and help her right away. But I know a lot of the times it's the reverse that, you have the child and then you're like trying to learn it at the same time. So I do feel fortunate that I already had that background, which was very different than I feel like a lot of people.
Yeah, that's awesome.
Yeah.
Your kids are very fortunate.
Yeah. She's like, what are you doing to me? I'm only 5. I have an expander in my mouth. So, yeah, it is great. Where are you located for the listeners?
I'm in San Diego, California.
Okay. So tell us a little bit then, fast forward, you ended up opening your own practice.
Yes. So I opened my own practice probably in 2017, and it was
Okay.
very slow. It was like I said, it's a side gig that I felt like it was a side gig at the time while I was
Okay.
learning more. And then I had also worked with Sarah Hornsby. So that's one of the things too, is that I had been able to be mentored through her and seeing
Okay.
patients. So I had someone overlooking me.
Very
And
nice.
I feel like that also helped me a lot because in the field, a lot of us need that mentorship. Everybody needs the mentorship.
Yeah.
And it's hard. Like you get all the information in the schools, but to actually implement it
Mhm.
is definitely tricky. But I am the kind of person that also likes a challenge, I guess, in that sense. I love
Mhm.
to create protocols and all of that. So for myself, I was able to hire a therapist right off the bat because I also still wanted to do dental hygiene. I was trying to balance both worlds.
Yeah. Yeah.
So, and she's still with me today. So
Oh,
she's
wow.
later, she's still with us and she's amazing. Yeah, that was about 2 years in. And the first few years, like I said, I did it part-time. And then now it's just kind of taken over full-time.
Hmm. Very nice. Yeah. Sarah's great. Her, mentorship and Myo mentor. She's wonderful. We do through Spot Pal, which is a company that I'm a part of as well. We do a lot for Myo mentor through that. So she's holding a conference in May. We'll be sponsoring that. So I'm looking forward to that. But that's great. Yeah, I agree with the mentorship. I feel like it is so important on our end, our practice. We train all of our therapists that work for us in myofunctional therapy, and it's about a year-long training that they go through. So there's a lot of learning it and then shadowing and mentoring and treating it. And then, when you get comfortable with that portion, we move on to the next level of training. So it's broken up into 4 parts, but I agree. I think, without the mentorship, I know there's some great trainings that are kind of like those 3-day courses, but I feel like that's just like such a small start. It's an important start and you need that start, but I think the mentoring and being able to, pick someone's brain on different types of patients because every patient can present so differently. So it's like you think you got a good handle on things and then the next person walks in and you're like, wait a second, this one's so different.
Yes, very true. And then to see, have those trained eyes to be able to see what you don't see.
Mhm.
Your speech pathologists are so lucky. awesome. That's amazing.
Yeah, yeah, it is. It's a great program. People ask us, like, will you train us? But we do keep it exclusive to our therapists because we just are so hands-on with it that I don't know how I mean, I'm sure we could modify it, but it just works so well when they're working for our practice and we're able to kind of just take them along that path and, be able to. I start with every patient. So every myofunctional patient that comes to our practice starts with me. And then I follow their treatment plan. So I see them for what we call reevaluation. So when they get to certain points in our program, we meet, I, check in, I make sure the skills that we expect at that point have been achieved, and then move them on to the next part of our program. So it helps me stay involved with every patient. It helps me give therapists feedback on what I'm seeing in those sessions. So it's an important part of, their training as well.
That's amazing. I do the same with my associate as
Okay.
well. Yeah, go in and then follow along every single patient. We meet about them, look at what's going on, troubleshoot stuff.
Yeah.
And I do love that part of all of it as well.
Mhm. Yeah, it is. I know. I enjoy educating and training and lecturing, so it's nice to have that part. And then the patient part too is always nice.
Yeah, agreed.
Yeah. And so tell me, I know in your introduction, I mentioned about you being the president. So the president of the National Network of Healthcare Hygienists. So what are you doing for that? That's amazing.
Yeah, so I was voted in as president this last year, or this year, I should say, 2026. And I had actually been a board member for years prior. I was also a founding member when it all started. And the vision that the founder, Jamie Dooley, has had, I've always aligned with, which is integrating in dental hygienists into hospitals.
Okay. Wow.
Is there's such a lack of oral care, not because of any fault of anything, except that there's so much going on in
Mm-hmm.
the hospitals, and usually oral health gets put to the side, but
Mm-hmm.
as dental hygienists, we know that has effects on the whole body.
Wow.
You don't
Yeah.
have a clean mouth, it's going to affect cardiovascular, it's going to have a lot of lung issues and pneumonia type issues that we see commonly people pass away from. So
Mhm.
that initiative and just empowering more hygienists to bridge that gap of the medical model is the foundation of what an NHH is. And for me, I've been asked to talk about airway and myofunctional therapy in the Oral Systemic Educator certificate program that they had a few years ago. And that has also helped. I'm passionate about educating other hygienists. And so
Mm-hmm.
that's connected me with a bunch of different hygienists in order to help them help more patients that
Mm-hmm.
go into this field
Mm-hmm.
of therapy. If not, go into the field, at least learn to screen your patients in order to be able to get them to the right provider to help them with this. But it's so complex, as we know, not just myo, but airway orthodontics and all of that.
Mm-hmm.
It's a lot to piece together. And so we hear often that, well, I know they have enlarged adenoids or tonsils, and I see that they're bruxing. Where do I start with all of it?
Mm-hmm. Mm-hmm.
That was a lot of the passion I had with that. And then as time went on, they asked if I would the board wanted me to do presidency. And so I was like, this would be something that I align with. I feel like there's a lot of dental professionals, not just dental hygienists, even though it is a lot of dental hygiene focused,
Mm-hmm.
that we can continue to help educate. There's a lot of us moving the field forward. And I feel like from when I started and nobody knew what I was talking about locally, to having study groups and multiple providers and passionate, like-minded professionals get together, I feel like that comes from having the study groups, continuing to talk about it, to continuing to plant those seeds. And I'm really excited to have NHH as one of those platforms to be able to do that for airway, but also how hygienists are essentially the same curriculum as nurses. We just specialize in dentistry. We do go to, our prerequisites are the same, and then we have to, branch off. They go to nursing school, we go to dental hygiene school.
Oh, wow.
We do have a lot of the education behind our degree. So advancing the field forward that way. So it's kind of they kind of intertwine in a way.
Yeah, that's amazing. I've had not heard that before, but it makes so much sense. They're in the hospital, and I'm thinking of so many personally, and I did some work in hospitals during my schooling, and yeah, it's never like, did you get to the bathroom and brush your teeth, or if they can't get out of bed, prioritizing bringing them their oral hygiene so that they can do it from the bed. And wow, I never actually really thought of that.
I know. And then many don't, because it's just, there's a lot of hierarchy of
Yeah,
human
yeah.
factors. So we
But like
strongly,
you said, so important because it could be contributing to, major health things at that moment or in the future, however it may be.
yeah, I remember Jamie was telling us a story of I think it was in the news, of someone who died from just a tooth infection that could have
Yeah.
been prevented really
Right.
easily. It's just that, what are the signs? What are the symptoms? What are we looking at? Are we getting in the mouth?
Mm-hmm.
If that went systemically.
Mm-hmm.
So
Yeah.
it's not
Yeah.
something that there's thought of, they're looking at all these other things, but it was a
Yeah,
contributing.
yeah. I'm thinking too, a lot of when I did some time in the hospitals, a lot of the patients I saw were stroke patients that just had strokes, and they're having difficulty speaking, obviously, but they have difficulty swallowing. And a lot of the times they have so much residue that just pockets in the mouth, and, all that obviously impacts hygiene. And yeah, it's not really even as a speech therapist, that wasn't even like what my focus was. It was about just swallowing and making sure they weren't aspirating and choking. But that oral clearance is important. And I think of that because if the mouth wasn't clear, they could end up choking or aspirating on that residue. But what about that residue impacting their oral hygiene in those moments too?
Yeah, exactly.
Yeah.
Yeah. So it's really bridging the gap where we can work together and really
Mm-hmm.
support patients in the hospital setting. So
Mm-hmm. Yes, definitely. That's great. And so you in your area, have you been able to find and build a nice collaborative team where you have referrals in terms of orthodontists that are airway focused and ENTs and dentists? I know some areas have more of that airway focused collaborative team than others, people traveling 2 hours to their closest airway focused orthodontist. How is it by you?
So that used to be me when I
Yeah.
first did. I would have to send up to Los Angeles area, which is a few hours, and it
Mhm.
was, tricky to get patients to do that. But I also felt like if I educated, I had to do a lot more educating to the families, where now I do feel like with social media platforms, so many people come to me, somewhat already educated, which is nice.
Mhm.
But yeah, I would have to do a few hours for them to travel.
Mhm.
So with continuing to talk to different orthodontists, even, upper cervical chiropractors,
Yeah.
everybody outside of the field have connected me with like different people. And of course, you go to specifics that are like, that's hogwash. We don't want to hear about that.
Yeah.
Being a little stonewalled with that kind of stuff, just to have that keep pushing forward, keep pushing forward. And I look back going, wow, that I'm glad I did that, because now I do have a handful of orthodontists who are airway focused, who are local, who are collaborative, who will hop on the phone to collaborate on a patient. And I find that could be very tricky, because a lot of orthodontists just want to, I'm sure you've experienced this, send the case and be like, fix the tongue. And you're like, well, we got to look at the whole body, not just
Yeah.
the way the teeth come together. I can't fix the tongue if there's no space for the tongue.
Mhm.
You're like, well, I don't know what to do. There's nothing else I can do. And so it becomes tricky that way. But also helping those providers grow. And those are finding the people who want to learn more,
Mhm.
usually have, again, the same things like we talked about earlier. They have things themselves, or they have children that are suffering from a lot of it that they
Mhm.
didn't realize, like, oh wow, I never learned this stuff. And I was there too. I was in dental
Mhm.
hygiene, being like, you go back after the first myo course going, oh my gosh, I missed so much for this patient.
Yeah.
And then sometimes that guilt goes in to be like,
Mhm.
oh, I should have known this
Right.
type of thing. And then you're
Mhm.
talking about it, and then you wonder, like, patients being like, well, why have you never talked about it before? So I'm learning the language of, when you only know what you know, and you move on and learn new things and continue to educate the patients and then collaborate with the providers. And so, yes, I've been able to, thankfully, not only orthodontists and chiropractors and osteopaths and all that kind of stuff. I've gotten a pretty good pediatric dentist, a good plethora of people, and then also other myofunctional therapists. I really do like collaborating with them, having study groups with them, because I feel like there's plenty of tongues to be able to help. There's also personality differences, right? Even in dentistry, some patients will, be better with this provider versus me, or vice versa. But I do feel like us collaborating together as myofunctional therapists is important to be able to move the field forward, because if we're not all together, that's not going to have the best momentum to educate the public on all of these things and empower them to go to their dentist and ask the questions, because that's when they usually will, at times when I do assessments, I'll get all the information of the dentist and all that, and I'll send the stuff to plant that seed, the report. And there's times where they'll come to me and be like, interesting, and they want to learn more too. So I feel like there's so many ways of spreading awareness with all of this. And if we just stay open-minded and support our colleagues and not see everybody as competition, even who are local.
Yeah.
Super passionate about that. So that's,
I agree. Yeah.
everything.
Similar. Yeah, definitely. There are, like you said, plenty of mouths, plenty of tongues that need this. I mean, you could be sitting in a restaurant and find, one at every table.
I know. You can't unsee. Once you know, you can't unsee any of it.
Exactly. But yeah, I think, as much as the field is growing and there's so much happening and so much research, we're still kind of on this island, I feel like. We're still not, it's not like every dentist or every orthodontist is agreeing with it. So I think it's so important that we're all collaborating and sticking together, and why I love going to so many conferences. I like to go to those ones that everyone, believes in my own. When we think, what are we believing in? It's not like a belief system, but okay. Because, it's powerful, because sometimes when you're by yourself, and I know a lot of therapists that treat myofunctional disorders, they are the only one in their area, and they feel like they don't, have anyone to support them. And then they go to these conferences and they're like, wow, there's this whole world of people that believe the same as me. So it is really powerful and necessary to keep moving the field forward.
I 100% agree. Yeah. And empowering everybody, and then to go back and for them to plant those seeds and to keep charging forward, because eventually it'll switch.
Yeah, definitely. And it is switching. I mean, the amount of referrals I get now from the medical and dental providers is huge and always continues to keep growing. The amount of referrals I get that are parent-based, I always love to see that, because I feel like, yay, the parents are getting the education and the awareness, so that when the maybe pediatrician does say, oh, it's okay, they're only 5, like, let's wait it out. They're recognizing, like, well, wait a second, I saw this on social media, or this on a mom's group, or my friend told me this. And so many new patients I get is because the parent is concerned about mouth breathing. The parent is concerned about snoring. And those are always my favorite, because I'm like, the maternal instinct and that gut feeling is so powerful and should never be ignored in any area.
I agree 100% to that one as well. To see the parents and they connect the dots and have answers and get to the providers that can support them, or you have that network for them to be like, consult with these different providers and you can get more information. And it's fun. I like that way. And honestly, that's how, like I said earlier, that's a lot how I've created a lot of the network around here, and how I've met the orthodontist that wasn't on my radar before.
Yeah.
It's just about spreading the awareness, and the more we can all hear or be on the same page with everything, and the patient hears it over and over, the more they're apt to be like, okay, everything's, they're able to connect the dots because it is a
Yeah.
lot. It's a lot
Yeah.
for to be able to see the whole picture. So that's
Mm-hmm.
what our job entails too.
Right. Yeah. And I feel like once we start pointing that all out and putting those puzzle pieces together, I feel like even for parents that are not in this field, they're kind of just like, yeah, that makes so much sense. Like, how could that not be it? Like, that makes so much sense that my child is, mouth breathing, and that's why they're having difficulties regulating because they're not getting enough oxygen throughout their sleep. And it just kind of all adds up. And it's nice to see that like empowerment that you give the parents too.
Yeah.
Yeah, very nice. So you do a lot with those going through palatal expansion. Is that something that you treat a lot of?
Yeah, so I work alongside a lot of orthodontists who will do
Mhm.
mark, even MMA surgery or, full-on jaw surgery.
Yeah, yeah.
Do that a lot in adults because, sometimes MARPE can't get enough of what we need. So a
Hmm.
lot of times they'll be doing MARPE before
Hmm.
doing that to gain a little bit more width of the palate, and it
Yeah,
has more of the surgeon to work with. So yeah, I do love the more challenging, quote unquote,
yeah,
cases.
yeah.
In my practice, I mean, I saw, 4 years old up. And then when I brought on my associate, she is a parent and she's very good at the behavioral side of everything. It was easy. She wanted to do the children or, children and teens. And then the other stuff with MARPE and full jaw surgery was very complex. You got to learn a little bit more. And so we decided I would take those patients and she would focus on the younger ones
Okay.
because I love that stuff. I love peeling back that onion,
Hmm.
explaining everything. But yeah, as an adult, with MARPE and needing those surgeries, there's a lot to unwind
Hmm.
beforehand and after, not just with me. And we're not
Yeah.
just talking mine, we're talking with body work and all of that as well.
Hmm.
So really a lot of it is guiding the patient through that. So yeah, I do see, I talk about consulting with a provider to see if you're a candidate to have MARPE and then going from there and seeing, what they see and collaborating and, supporting their plan, the orthodontic plan. I think
Hmm.
that's one of the things that from a hygiene perspective, we're used to that because
Hmm.
so many patients will, the doctor will come in, do their exam and be like, you need a crown, you need da 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 da, and then they leave. And then the patient goes, what did they say? And they're like, okay, this is what they're explaining. I think that training, I didn't realize it would come in so handy, but I
Hmm.
think it's just most hygienists, not that others aren't, but most hygienists are just, it's innate for us to always explain what they're talking about a little bit more.
Yeah, I could see that. I've lived that for sure with my own dental stuff.
Oh, yeah.
It's like, okay, okay. Then the dentist leaves the room and I'm like, what did he say?
I don't know why. I think it's just, the digesting it.
Yeah.
Like things to digest and be like, okay, there are different ways of layman terms and that.
Mhm. Yeah, yeah.
And so I feel it's the same with Myo. So again, the reason why having that collaboration and being so close with those providers to be able to go back and forth is important. So
Mhm. Yeah, yeah. We're mostly pediatric. That's definitely our biggest caseload here. We see adults as well, but I would say probably 80% of our Myo caseload is pediatric. But yeah, we do a ton with palatal expansion. I'm, obviously always referring because a lot of the times they do get to us first, especially when they're younger and especially if it's impacting their speech. So they'll come to us for something like a lisp, a difficulty with an R sound, and we'll uncover all the OMDs that are present and explain why we're recommending myofunctional therapy to support the symptom of expressive speech errors that are coming because of that. And then if they're maybe 7, that's like a very popular age that they'll come, probably because that's one of the pediatrician is like, okay, maybe they should have those sounds by now. We would love them sooner, but that's okay. And, a lot of the times it's a, oh yeah, we haven't seen an ortho yet. Dentist hasn't, they said we need to lose more teeth still. So giving that education of like, this is an appropriate time to see an orthodontist. Let me give you the names of some that have this more myofunctional and airway type of specialization to their practice. And, for us on Long Island in New York, there's so populated. So many dentists, so many orthodontists. So it's hard, we definitely do what we can to I lecture at like the county dental society meetings and things like that. But I understand and recognize that this is not how every, dentist or ortho chooses to want to practice. But having that collaborative team that I have people that I can say, well, here are a few names that I would recommend and let them kind of start there has been really helpful. And then every once in a while, they do get to us when they're 3, 4, and we say, yay, okay, let's go do this now.
I know. I love it when I see, parents will reach out to me or our practice and they'll be like 2, 3 years old, 1, 2, 3. And I'm like, no, it's not time for myo, but you still can see feeding therapist,
Yeah.
occupational therapist. And so even connecting with those providers who
Yeah.
see that younger population, because you're still helping that child and the family. And a lot of times they have older siblings that have the issues themselves. So I never see it as a negative.
Right.
To be able to still tell them where to go and guide them. They want that guidance. So it's still good, in my opinion, to collaborate with those providers who you might not see the same population because set that kiddo up for good airway.
It's so important. Definitely. I've had, some in the past it'd be like, oh, as soon as he turned 4, we scheduled with you. We knew we had to wait. And I'm like, obviously not going to say anything to make them feel like they shouldn't have waited. But I think it is important, especially for other professionals to recognize, like, sure, we might not do myo, until they're 4 or older, but we can do oral motor, we can do feeding therapy, we can support them. I have so many times parents will call and they'll do an intake and want to schedule their 2-year-old and it's, mouth breathing and all the right things and definitely perfect. Let's, do this evaluation, but they'll say, we want a myofunctional evaluation. And, it's a secretary, so they're not, trained in any of this. So they're trying to communicate like, oh, we don't do myo. And then I'm like, okay, let's like train you guys on how to say this, because leave it to us to tell them the difference, but let's just, not try to tackle it on the phone.
It's tricky. It's a tricky concept for the public to understand. But I think with time and continuing, like I said, to educate, I think it'll be pretty easy to see the difference.
Yeah, absolutely. And then a little bit, if you have a few more minutes, in terms of, we didn't really get into anything with tongue ties. And, I feel like we've made a lot of headway in our field of always, recommending and doing myofunctional therapy before and after tongue tie. And I know that's probably a lot of what you also see and a lot of what we see, but are you getting a lot of those types of referrals?
Referrals from providers?
Yeah, from like release providers.
Yes. A lot of from the release providers referring before they'll do any release, which is insane. And then there's also a lot of patients that come to me that have done some of the research saying my, provider recommended a release and we could do it right then and all that, but I knew better.
Oh, wow. That's great.
So that has been the last few years. And I'm like, oh, this is great.
Yeah.
As obviously we need function and all of that beforehand and to have a full complete release done. So we don't have to do it over and over and over. So it's tricky. As we all know in the field, it's hard to go through a lot of the systems where there's insurance coverage and all of that stuff, because they don't always, in my opinion, support or do complete release, not because they don't want to. It's just that they haven't done that extra training and realized all of the things. So yes, I do get a lot of providers here after creating that platform that will refer before tongue tie release, but also not do a release at all. Wait for my clearance to say they're functionally ready to perform this. So I feel very lucky, but in the beginning there was 1 or 2 but I would send up to Los Angeles again to Dr. Zaghi and all of that, because I would get people coming back from a tongue tie release, and it'd be no myo. It's after the fact, having to do it again, scar tissue, all these things that don't help improve the range of motion, which essentially doesn't help myofunctional therapy. You're always learning. So I explain my experiences before to patients of why you want to go to a provider that has more tools or have done the training and really passionate about it. And most of us have had the things ourselves or had the family member that has the things. And so I explained that before, this is how it used to be. And that's my experience. They didn't know, but for me, it makes me sad because one, don't want them spending more money than they have to. We don't want to do multiple releases if we don't have to. There's many reasons why. So when I educate them on the providers to be able to go to have these releases or to have them be consulting for the release, I explain all of that stuff too. Like, why am I referring you to these preferred providers and what's the difference and all of that. So education again.
Agreed. I do the exact same. And I agree with you 100%. It's sad and hard when someone comes to you and they've had the release and they didn't do anything before. They maybe weren't released by the right release provider, and you're looking under that tongue and watching them elevate and move that tongue and seeing that there is still signs of restriction, because no parent wants, especially when we talk about the pediatric patients, no parent wants to do that again and go through that again and have their child do it again. And, it's a hard conversation to have. And it's so much better when it's the opposite, and we see it first and we can do the myo and guide them on when it's time to have that consultation, and then support them immediately following it. And of course, also very helpful when it's a release provider that's saying, hey, before I do anything, you really need to start working on some functional stuff and do some myofunctional therapy, and then they'll let me know when you're ready for it. And that collaborative approach to this is what's allowing for those optimal outcomes and starting to really change the message of, tongue ties, and releasing the tongue tie had such a bad rap for a while because all they were doing was releasing a tongue tie and not doing anything before or after. And, I always explain it's all muscle memory. So it's important to me that the parent recognizes just because you do this procedure does not mean everything is going to just magically change. We have, it's an important piece of the puzzle, but it's only a piece of the puzzle. We have to then get in there and show those muscles what they should be doing, have that neuromuscular re-education and change those muscle memory patterns. And yes, we may not be able to do that without the tongue tie release, but again, it's not the end all be all answer. It's what we do after that's so important.
Yeah, I agree. A lot of people will think it's the end all be all answer. Just clip it.
Cut it. That's the worst one.
Like, oh gosh, no clipping.
I know. I get sometimes, they cut his tongue. I'm like, let's reword that a little. But, it is. And I understand, there's so many surgeries that you have, and the surgery is the answer, right? The surgery is what fixes it. But it's a different situation because we're dealing with so much muscles, and we have to train those muscles. Similarly, I explain with the tonsils and adenoids, could it be a very important piece to the puzzle as well? Definitely. If they can't breathe well through their nose, and we're going to be limited to what we can do. But again, muscle memory right now is mouth breathing. Muscle memory is tongue down and low. So even if we take away that obstruction and, shave tonsils or shave adenoids, and, it's not going to just magically always happen. We have to guide those muscles and teach those muscles and get them doing what now they have the potential to be doing.
Yeah, agreed.
Yeah, it's all collaborative. Everything's got to work together.
Yeah, and I think, like I said, the hardest part is learning all that as myofunctional therapists of like, where do I even start? So that's where the mentorship and stuff goes in with all of it. So I think
Definitely.
knowing how to speak to the patients is
Mhm.
very important as well. And that comes with time and
Mhm.
mentorship.
Mhm.
Uh, but once you get it down and be able to support those families, it can be very rewarding, in my opinion.
Definitely, yes. And it's always great to see, you know, the field evolving and see your surrounding area becoming more and more aware, and the conferences are growing, the trainings are growing. You know, I remember when there used to be like two places you could go to get trained in myofunctional therapy, and now there's so many, and they're all filled. So same thing, there's enough mouths, there's also enough therapists that want to learn this. So, you know, important that we're all just working together and keeping the field positive, and we're all working for the same purpose, which is for our patients and for bettering our fields.
Yes, I agree.
Yeah, thank you so much, Tamara, for being here. I know it was an early start on your end.
Perfect. Good way to start the day.
Good, perfect. I appreciate you chatting all this out with me. I know it'll be great for the listeners. For anybody who wants to know a little bit more about you, do you want to provide any website, Instagram? I know you have a pretty big Instagram and great
Oh,
posts. Yeah.
sure. My website's just facialphysique.com. And then Instagram, I'm passionate about, again, spreading awareness, or at least giving some of the research that's out there so families can be able to make educated decisions. But that one is Facial Physique Myo.
Perfect. Thank you so much, and have a wonderful rest of the day. And I look forward to hopefully seeing you soon at one of these great conferences.
Thank you for joining us on this episode of Talk the Talk.
We hope it was enjoyable and educational and further supports you both personally and professionally.
For more information, please check out our Myo and Myo Minute podcast, as well as our other episodes of Talk the Talk. And don't forget to check out our tongue training appliance, SpotPal, to help with tongue thrusting, thumb sucking, snoring, TMJ, mouth breathing, and so much more. Visit thespotpal.com.